I'd like to request if anyone would like to start us off with an opening prayer. Reverend Cousins, are you on the call?
Yes, I am.
Would you be able to offer us an opening prayer before we start?
Sure, let us pray. Gracious and eternal God, we come before you today. God, we ask you in our city, in our homes, pray that you continue to watch over us. Pray, healthy. We ask that you bless this administration, bless the community, and bless those who are just going to be in your. These are all the blessings and praises. Amen.
Amen.
Amen. Thank you, Reverend Cousins. So I'm just going to give some brief opening remarks, and I may have to hop off the call partway through, so I apologize. I won't be able to join the whole call. Again, I appreciate the level of participation and interest. The faith community has really been our close partner as we contend with this pandemic in an ongoing fashion. Unfortunately, what we need to talk about today is a very real possibility of a possible resurgence of cases. As many of you know, we contended with that issue back in March and April. We are seeing evidence that we might be contending with this issue again. If you're following the news, you know that there are more than 30 states on the quarantine list for Connecticut. So if you're traveling in from those states, that you have to quarantine. That signifies to us that we are not even close to out of the woods, and we have to continue to prepare ourselves. And we appreciate your partnership in doing the best you can at your houses of worship, as well as being messengers to your parishioners and community in how they can keep safe. So with that opening, I'll turn it over to Director Bond of the Health Department.
Good morning, everyone, and thank you for your participation and attention. You know, as Dr. Dalal mentioned, today my hope is to cover really an update and talk a little bit about the status of where we are with COVID-19 and just have a refresher on identifying the symptoms and steps that we can take to reduce the risk of exposure within your respective houses of worship. I do hope that we will have enough time to then open it up for questions and answers so that we can be able to have more of a dialogue. Joining me on this call is also my team members, Brian Weeks, my epidemiologist, and Dr. Vasquez, Director of Nursing, who will be on the call in support in the event that any questions come up and be able to assist you in any way. So as you know, COVID-19 hit us this early this winter, and it's a respiratory illness that spread through person to person, and it was first identified in China. And it's really spread through close contact to contact. And so I just wanted to sort of reiterate that. And so the public health updates that we want to share is first and foremost a disclaimer that this is provisional data and is updated as of this morning, as of yesterday, and will be changing later this afternoon as we report continuously. So please do visit our website for current data as well as ct.gov. And so in the city of New Haven, since our first case reported back in March, we have had 2,833 cases and has impacted our city as a whole. But giving you a sort of a scope of where the hotspots have been in different areas of the Hill, Fairhaven, and in Westville areas as well. One of the things that we track as part of the reopening is public health indicators such as hospitalization rates. And so what you see in front of you is the current cases of the hospitalization beginning in April for the greater New Haven area. So we are seeing a nice downward trend of inpatient cases in the greater New Haven area. And so that's good news in regards to ICU and inpatients. One of the things that we try to do and the ways that we've been trying to really stabilize and flatten the curve is really working towards quarantining, testing, and doing contact tracing as an effort to making sure that we can identify where individuals are, and then also making sure that people isolate. And so with that effort, we have been very successful here in our city and in our state in comparison overall to the United States. This is a document that you are all familiar with, and some of the reopening that the governor issued. And so this is just a reminder that everything was regarded in regards to safety first. Can everyone hear me? Oh, to safety first, science driven, and making sure that we are using a combination of hospitalization, public health indicators as well, in order to be able to remain open. And so some of the things that we talked about for the guidelines of an overview a few months ago when we conducted this webinar, we talked about the guidelines for reopening, and many of you have reviewed these guidelines. And I thought today what we can do is just sort of reiterate, as you saw perhaps in the news and in the New Haven Independent, we had an unfortunate cluster at a local church, and we just want to make sure that we reiterate a lot of the reopening guidances and provide any support to each of you that you may need, and just do an evaluation of where your current safety measures are currently in place. And so, as you know, we are still at the 25% capacity of indoor space, not to exceed 100 people, depending on your size of your houses of worship. We also have outdoor gatherings of 150, and then the drive-in and parking lot services that need to make sure that are properly social distancing and making sure that windows remain closed during services. You know, one of the things that we talk about is making sure that the methods of really supporting the operations of your houses of worship. One of the things that we stressed early on with the reopenings of churches is having a designated program administrator and appointing someone who will be accountable for implementing the health and safety guidelines and really staying abreast of what's happening on a national basis, state basis, and then local basis in regards to CDC guidances and other guidances that are issued from the governor's office. Making sure that there's a cleaning plan that includes disinfectants that are EPA approved. Some of the things that we have seen and received complaints about are individuals utilizing products that are not EPA approved, and things such as the Pine Sol, for example, on cleaning doorknobs. And so just being mindful of making sure that your cleaning plan, number one, is laid out and reviewed with all of those that are either staff or volunteer, and then also making sure that you have a designated bathroom log tracking the frequency of how you are monitoring and cleaning the restrooms. So for example, when you have a service that may go for more than an hour, let's say 2 hours or 3 hours, you need to ensure that you are cleaning the bathroom throughout the service and not just before and after service. That's just one example. Making sure you have a thorough cleaning plan of the seating areas and any high touch areas, and training the staff to make sure that they understand the guidelines and the protocols. And most importantly, the personal protection, making sure that upon entry at all times, people are wearing the personal protection so that you can reduce the risk of prolonged exposure. There's of course alternative to services that we early on wanted to promote and foster. Some of you are still practicing this, and every houses of worship have made different decisions. And so we still want to continue to promote the messaging that consider alternative in-person alternative services instead of in-person services, like online services, and streamlining from different avenues. We mentioned drive-in and parking lot services, and just sort of reiterating that that's optional. Having pre-registration for on a web page and collecting contributions online, anything that's going to reduce the frequency of contact with another individual or prolonged period of time with an individual. We want to strongly encourage and reiterate that those that are at risk and have comorbidities aka pre-existing conditions, we please ask that we dissuade them from attending in-person services unless you're going to create a special service for those that have pre-existing conditions that can reduce the risk. We want to ensure that you're following the CDC guidelines on dissuading individuals of any great exposure to COVID-19. And so it's important that you provide either an alternative service or a special service specifically to that population. Seating arrangements is really critical, rearranging, and I know that many of you have made this effort, but we just want to do a refresher. The seating arrangements must be 6 feet between attendees. If there are household members of 2 or more, they can definitely sit together and adjacent to each other, but however, there needs to be alternate rows, and so being able to be mindful of that new capacity and staying within that arrangement so that you can ensure that you have the proper distancing between the members. You also want to make sure that you have visual social distancing markers so that people can know what those are, so that they're adhering to the new rules that you have put into place within your special places of worship. And then having reserved seating in the event that you want to have reserved seating for specific at-risk populations, for example, so that you can be able to sort of put them in a specific location away from other members. And so we want to make sure that you also have some protocols before people are entering your houses of worship, and having a pre-screening protocol or ensuring that people are reporting their temperatures before they enter the congregation or your places of worship. That's going to be important because we want to make sure that you're pre-screening before people enter your houses of worship with the CDC COVID-19 symptoms. And so developing a log that's going to be able to track that, tracking the members that are coming into your houses of worship, because in the event that you have an unfortunate circumstance of someone developing symptoms or reporting a case, we can assist you with contact tracing relatively quickly. And so we want to make sure that you have the alternative to be able to have that. So it's critical for a log to be maintained of the attendees that are coming to each of your services. We want to make sure that greeters that are going to be posted at the entrance inform the maximum capacity, so making sure that they're enforcing the maximum capacity. So making sure that the greeters and the ushers have the proper training and that they're kindly redirecting members. Making sure that you have one-way traffic of entry and exit points, and then also making sure that you have the proper ways that you can eliminate any potential crowding in any specific areas like cafes or libraries or things of that nature. And the common spaces that you may have for any congregating, we are asking that we discourage that at this time. Any religious rituals, performing the rituals are exempt from social distancing, given that other attendees and guests are 6 feet apart. Any singing is really highly discouraged, but we are recommending that you have an alternative method. If not, everyone has to wear face coverings and maintain 6 feet apart from each other. This is really, really critical in making sure that if you're going to be utilizing the microphones and sharing microphones, that you're utilizing the proper cleaning and allowing at least 10 minutes between the cleaning of microphones so that you can ensure that that they are going to have the sufficient time to be able to be cleaned. And then also any choirs are discouraged at this time and should be suspended. And I just want to caution you, those of you that do live stream, to be mindful that things are being reported. People are very concerned about their health and well-being, and are reporting videos all the time to myself or other departments throughout the city. So I just want you to be mindful that if you're going to be not removing your mask so that you can share your message, you need to have at least 12 feet apart from the first guest in the first row, and making sure that there's markers that distinguish that so that people know that you have taken that into consideration. Nurseries are recommended not to be offered at this time. If you decide to move forward with providing nursery services, they should follow the CDC guidelines and making sure that the staff are properly trained to be able to, of course, have the pre-screening similar to the pre-screenings that are happening at the beginning of the services. Youth services should, anything that's in person should be limited, including Sunday school. And also suspending classes that are large group gatherings, and then discouraging any groups of other services. Offerings and contribution, as I mentioned, trying to get individuals to offer services that can offer contactless as much as possible to reduce the risk. And then making sure that if communion lines are going to happen, making sure that it's a single file with people 6 feet apart, they should be disposable. Common items, again, discontinue any sharing of items as much as possible. And the ventilation is another critical component, making sure that you have a thorough assessment of your ventilation system. This continues to be a concern in many different sectors. And so making sure that the percentage of the outdoor air that circulates into the system where possible. And also discontinue any food and drink services at this time. We want to make sure that you have proper signage when you have that are visible for your members. CDC has all of these posters available in multiple languages, and so just making sure that you have the proper signages so that you can discourage, and you can encourage individuals to adhere to the health and safety protocols. Again, making sure that you have the proper signage in hand sanitizers available as well, and hand washing signs, and I'll show you an example that CDC has. And so what we want to do, this is the daily health check example, and so when you're creating the CDC, your log, just making sure that you sort of check off the different symptoms and that the member signs off and initials at the end. And making sure that member and clergy and employees are also receiving the proper training and are adhering to the personal protection requirements as well. And also, being responsible for providing that to your volunteers in the event that they do not enter their premises without a mask. And of course, any attendees and volunteers should wear a mask or cloth face covering in the event that they need it. Really quickly, the City of New Haven has web portals for information that will be useful for you. This webinar will be posted on this website, and so you can see this and other guidances that we have issued on our website. We also have access to testing. Access to testing was a priority for us as a city, and so we have a private-public partnership with Murphy Medical Associates, and we're promoting the community health centers, as well as Yale New Haven Hospital, new RV mobile testing sites area, as well as the Ross Woodward School. And so please visit our website so you can be able to get access and promote testing to your members. And so, of course, this is our mask up. This is just distinguishing the different types of masks and the ones that are intended for the different users. And so N95s, of course, are for primarily healthcare professionals and first responders. And surgical masks are one-time use only, and really fabric masks are more than respectable to be wearing in houses of worship. This is just an example of our Mask Up campaign. Anyone at any age can get the virus. We have these throughout the city in promoting our hotline as well. This is another example of signage of symptoms. So you want to have this at the front and in several areas of your houses of worship as well. And this is another CDC poster that you can utilize. This is an example of daily screening and staff that you can use so that you can create and then be able to make sure that you can have the proper sign off of the individuals that are attending. This is an example for your staff or your volunteers, but you can create one for your members as well. This is a process and a new initiative that the Department of Public Health is now promoting, is how to get tested journey, and so people can have a good understanding of what the process looks like. And so this is a good example of what can be shared with your respective members, and this can be found on ct.gov/coronavirus, and you can download the kit and it's available to you in English and Spanish. And this is just another example, again, of stop the spread of germs. And I think infographics are useful because they can really provide a visual and and offer gently reminders of individuals as well. This is another example that can that should be in the restrooms, so that reminding individuals to wash their hands and be able to display them within the restrooms. Our hotline, we are available and are at your service. If you need assistance with COVID-19 questions or concerns, or you want us to review protocols that you have modified and would like our input, our epidemiologist and director of nursing are available to you. You need to report a case. If you have a case or more than one case being reported by your members, you should call the hotline and report that so that we can be able to assist you with any contact tracing that is needed. These are some resources of things that I've highlighted throughout the webinar, and we will again be able to provide this. What's good about one of the things that I like about the CDC, they have videos that can be displayed. So if you have monitors before service, you can actually display some of these videos and loop them before you start services and even at the end of your services. And so that concludes my presentation for today, and I really would like to open it up, and I'll turn it over back to Carlos, who can facilitate our Q&A. Thank you so much for your attention.
Thank you, Maritza. Once again, thank you everybody for participating with us. We're gonna open Q&A / discussion section of the conversation. So please, if you want to speak, have a question, want to share best practices, just unmute yourself and talk to us.
I have a quick question. This is Jerry Streets at Dixwell Congregation, New Haven. Did I see correctly in one of the graphs that people should actually try to get tested monthly?
Yeah, so if you are at a great risk, we are recommending to get tested monthly. However, if you have been exposed and you feel like you're at risk, there's access to testing that can, so at any point that someone feels like they want to get tested, but we do recommend monthly for individuals that are coming in close contact with others and are posing at a risk, like being a frontline worker.
So you're not recommending testing as a general practice. You're just people who assess themselves as being at a greater risk. I'm just trying to clarify.
The risk of exposure. So if you have exposure and you're gonna be, so like for myself, I have a greater risk of exposure because I'm around people more frequently. And if you're gonna be around individuals more frequently at any type of sector, then we do encourage you get tested monthly.
Thank you.
And nice to see you, Pastor Streets.
Hi, this is Tim Kyle, Bethesda Lutheran Church. What are the guidelines in regards to small groups that might be meeting in the church? This is something we're puzzling about. It was brought up, I think, at another meeting about support groups, 12-step groups as being kind of important for their own emotional well-being, and whether there are guidelines for those kind of groups. As far as congregation meetings, we're discouraging people from that, but we have started outdoor worship and are considering what outdoor gatherings might look like.
That's a good question, and I can always have Brian Weeks add to my comments. So as you know, small groups are discouraged indoors because of the air quality and just a prolonged period of time. Certainly what we've recommended is to try to have them virtually, if you have the ability to offer them virtually. And if you have them outdoors, yes, it's nice now because it's warm, but then we're gonna be transitioning into the winter months where it's gonna get cold again. So you certainly can have them outdoors as long as you're having the proper social distancing and having everyone wear masks. So certainly outdoor groups is allowable. Not enough. Brian, did you want to add?
No, that outlined it pretty well. I mean, again, we want to just kind of set the standard. Now is a good time to also practice trying to do digital services or classes or any other kind of meetings, because especially fall, winter time, the odds are fairly high in terms of activity increasing for COVID-19.
And would any of that change in, let's say, a phase 3, or are we just not talking about that.
We're not
Right.
talking about phase 3 yet. We're
Yeah.
not quite ready.
Yeah,
So
that's
as you
fine.
know, yeah, so unfortunately, as you know, we're surrounded by a surge around our country. We're at 34 states with the travel advisory. And so we're currently remaining at phase 2. And because we're seeing a slight uptick of cases, even within our city, we are now reconvening all of our sectors just to have a conversation as what we're having now on stepping up our health and safety measures so that we can remain open. So we want to do everything possible because it really takes a community, and it's a social responsibility of ours to really ensure that we try to work together on flattening the curve.
So,
Thank
Doc,
you.
this is Hudson, and good to see you again, and thank you for your presentation. This may not be the right question given the group that you're speaking to, but now that I'm actually speaking to you for representing the health department, if you're meeting with your sectors now regarding, especially with clergy, you're talking about giving us guidelines for churches and really emphasizing streaming our worship services altogether. What if we're doing this and you've seen an uptick? Why is there such a strong push to actually send kids back to schools? If you're concerned about ventilation systems and things like that for churches, don't we not have the same concerns for our school buildings?
Absolutely. And I'll have Dr. Vasquez add to that because she oversees all of the school nurses. We certainly have a health committee, and if you all recall, I was probably the first health director in the whole state to decide to close schools. And so part of the reopening guidance, I have to work closely with the superintendent, and we're not going to reopen and put children at risk. And so what we're doing is closely monitoring the public health indicators that are being introduced by the Department of Public Health, and they just introduced them yesterday or 2 days ago. And we're closely monitoring that. And I think Dr. Vasquez, if you want to add a little bit about what some of the efforts that we're doing to sort of ensure that we properly, safely open, not just for the children, but for the adults as well, because many of them have pre-existing conditions.
Absolutely. Thank you, Director Bond. So in the schools, as Director Bond said, we are working closely with the Board of Education and also with the State Department of Public Health and State Department of Education. Many of the guidelines are set out by the State Department of Education and by the governor's office. So at this time, it is mandated that schools reopen in some capacity. But again, those metrics are being closely monitored, and that may change prior to school opening if we see cases rise. In planning to reopen schools, putting a lot of plans in place to protect all students and staff, including the wearing of masks, the use of PPE, disinfecting and cleaning the schools, decompressing the number of students and staff in the building at any given time, having backup plans for online learning should schools need to close, or should the schools move to an online hybrid model, which would be part of the time in the school building, part of the time online. And then our nurses will be working closely in every school, screening students that may have symptoms of COVID, rapidly assessing and isolating those children and dismissing them to home, following up with families for what care or testing they may need to get for that individual, and then clearing the children to say that, yes, in fact, that child is able to return to school and that they are healthy enough to return and not put themselves at risk or anybody else in the school building.
I have a quick comment and a question. I appreciate Dr. Cousins raising it. I have 2 adult children who are public school teachers in New Haven. They are terrified about the prospect of returning to the classroom to teach, as much as they want to do that and love their students. I don't think we should open schools, period. And I know that that's a political question, and as well as other dimensions to it. and the inadequacies of our in the inequalities of the school system across the board. We are aware of all that, but I think we need more time to really try to address some of those inequalities and structure the school physically and get teachers and parents ready and children. I was really discouraged when I was listening to the panel discussion last night on Channel 8 when one of the school officials responded to the question that there are no guarantees. You can't guarantee anything 100%. And I immediately thought about, well, what parent wants to be in that percentage that's not guaranteed? If you can guarantee 95, 98, 99, 99.9, what parent wants to be that 0.1 and taking a risk of losing their child? So my comment is that I would really encourage a conversation with the mayor, with the governor, to pause this thrust to open the schools in less than a month. That's my comment. My question is I've actually forgotten the question because I'm even having a senior moment, but I was thinking more about the anxiety that I was hearing from my 2 adult children who are public schools teachers. If I remember the question, I'll come back with it. Thank you.
This is Warren Roof calling from the Adventist Church. What about circulating fans? We have no AC. We have very limited windows. It's an 1882 church. We do have circulating fans on the floor that we use in the summertime. And if that doesn't work, what about personal fans that people can bring for worship services?
Yeah, I'm going to defer to Brian to elaborate on that.
If you're talking about fans that are on the ceiling that pull air around, it's recommended that the air is pulled upwards, so the fans are, set in that manner. If you are talking about, ventilation, in terms of if there are windows, you can open windows as well to get fresh air. The goal is to get fresh air into the room. In addition to that, I also recommend or suggest if you do want to include fans, you can also put like window units inside, window units, but the air should be pulling outwards to the outside. The goal is, again, just to ensure that there's adequate fresh air, and then there's continuation of that air not getting to other individuals. So that's kind of the general goal there. We also can kind of share some other guidelines that have been put together by ASHRAE, which is like the organization, National Organization for Ventilation, Air Conditioning Systems, and things like that. And so there's general guidelines there as well as from the state that could provide additional.
Thanks, Brian.
I remember the question. You mentioned earlier about the slight increase that we're seeing in New Haven.
Yes.
Any idea about where that increase is happening and why?
Yeah, I think I shared it. I shared it in a slide earlier. Let me just get back to it. 1 second. Actually, let me just go into the actual dashboard because I want to be able to show it to you all. So one of the things that we do at the city level is that we developed a dashboard specific to New Haven cases so that we can be able to share with all of our constituents where exactly our cases look like as a city. And so currently what we've been doing now is monitoring in a 2-week period and sort of just trying to see where the trends may be happening. And so what you see here in front of you is that we have about 36 cases in the last 2-week period. That number seems relatively low. Nevertheless, we were having 1 to 2 cases per day just about a month ago. And so we're seeing, if you see in front of you on the bottom right, that we went from like 1 case to 3, jumped up to 8, downward to 4, and then we're seeing a little bit more of a downward trend again, which is good. We're also seeing a percentage of increase among youth. So the cases reported in the last 2 weeks 17% was 0 to 9, and then 25% 20 to 29, and 31% 30 to 39. That still has been a little bit consistent. The higher number was within the youth. And so there's a variety of reasons why that could be happening. We are in the summer months, and there are people congregating more frequently than in the winter time. And so what we want to do is, I'm going to just show you this map, the current map. What we wanted to do is make sure that we increase our messaging, and then also have webinars as the one that we're having right now, because in the last 2 weeks, we also had a minor cluster within a specific church where 10 cases came from a particular house of worship. We also worked with Lighthouse to ensure that they had more restrictive rules. And also Longworth, as well as the flea market on the boulevard. So what we did is, where there's any congregating happening for a prolonged period of time, just making sure that people are just taking additional measures and just sort of doing an evaluation of where they are to ensure the safety of their constituents or customers that they serve, or your members in this case.
Well, based on, first of all, let me echo. This is Pastor Mathis from Springs of Life Giving Water Church. I want to echo Dr. Street's concern that he hears from his daughters, but I want to also say that I hear from my congregants, those who are in the educational system, either as teachers or administrators, that there is a fear among them because of the possibility. So based upon the data that you
You're breaking up. I'm not able to hear you, Pastor Mathis.
shared, in particular, based upon that data.
Pastor Mathis, you're breaking up. I'm not able to hear you. I'm so sorry.
Oh, okay.
You're like,
How about
Disable your video? Disable your video, because it might not be able to have enough bandwidth, so we could just hear you.
okay? So based on the data of young people, that percentage which has been consistent, I would assume you would compare that across the state. What is the justification then for students returning to school?
so that's a good question, and we just addressed it right before you logged in. So there's 3 models that have been introduced, and based on the public health indicators, the different models will be considered. So there has not been a definitive decision of how we're going to reopen. The superintendent presented 3 plans based on, and the decision will be made based on public health indicators of where we are with cases. If we are, and Dr. Vasquez just answered this, and she can add to my comment in a minute, is that if we see a surge happening, then we will not be able to open. And so the health and safety of the children and the adults in the school, both staff and others, the administration, we have to take that into consideration. As you may recall, Pastor, did he disappear? Mathis, oh, he's still there. We closed the schools before the surge even hit our city to make sure that everyone was going to be safe. So we're going to do the same steps to ensure the safety before we reopen. And especially when we have an urban city where we have to take additional measures of looking at the landscape of our classrooms and making sure that that we can safely reopen. So we have a health committee, and Dr. Vasquez can add to some of the comments that I just mentioned, just to sort of reiterate what was shared previously.
Okay, thank you.
Dr. Vasquez?
Yes. So echoing everything Director Bond said, again, we're watching those metrics very closely. Screening children, we're encouraging all families to screen at home prior to sending their student to school, and then staff will be following that same procedure. So again, we're still putting all of these pieces together, and the guidance documents are being updated almost daily from the state, from the CDC. So we want to make sure we're doing everything to protect everyone.
And just one follow-up, if I may. So based upon that strategy, is the city/public health department, educational department, educating homes and families of what the screening entails and providing the mechanisms or tools to do that screening?
Yes.
Because again, okay.
Yeah, no, that's a good question. That's actually a really good question. Yeah, so the Board of Ed are having almost weekly meetings, Jennifer, at this juncture with parents. So that's one of the things that we want to increase awareness about, is that there are Zoom meetings for parents and even interpreter services available, and where parents have the platform to share their concerns and be able to be updated as things are being introduced. We presented at the Board of Ed meeting just 2 weeks ago on our health and safety efforts that we've conducted so far. So it's going to be critical as faith leaders that you also take an opportunity to participate, because you represent a lot of their voices as well, in case other parents are not having the opportunity to attend. And also there's a meeting schedule posted on the Board of Ed website of these different meetings.
And there will also be materials in the packets, the orientation packets that go home to families prior to school starting. There will be information in there. There will be some screening tools for families to use, and we'll have those in various languages to assist families with being able to use those tools. And then also the orientation this year for each school, I believe, will be held by Zoom. So that information will be reviewed during those orientations.
Dr. Bond, this is Reverend Cousin again. I believe in your presentation, you spoke about how your team is willing to come into the churches to actually give us guidelines or protocols in returns of health and safety. I was wondering, what is your volume to actually carry out that particular statement? Because I'm pretty sure there will be churches would like for you to be involved and just to take a walk through of our churches to see and give us recommendations for how can we actually safely reopen.
Yeah, so that's a good question. So the statement that I made is that you can send us the protocols that you've drafted or that you have already have in place, and we can assist you with updating them. We can conduct a site visit, and so if you call hotline, we will coordinate a time. We have done assessments of places of worship. They haven't been as frequent, but we'll be more than happy to come out and provide recommendations. That's what we're here for, is to provide that assistance, because we want to make sure that everyone is able to remain open and be able to have the proper measures in place to have a safe service as much as possible.
Example
and then I'll share, I will also share my email.
From the example you gave about a church recently that had an outbreak as they gathered, has anything been learned about that experience that we didn't know before?
And so what we learned is that there was a couple of things we learned. The first one is that they did not participate prior to the ongoing webinars that we have had. And there was a sense of miscommunication on invitations. They didn't receive them for whatever reason. And then number two, one of the things that we discovered is that they were following some of the protocols, but not consistently. They didn't go through the reopening guidelines completely. And so they were doing some things well, but others they were not. So for example, they were not pre-screening individuals before entering their places of worship. That's really critical, because then you can be able to know if someone is sick, especially a child, that their symptoms are less severe than an adult that may have a pre-existing condition. And if you can catch that early, you can discourage, ask them to not enter the service and to seek medical care. And the other factor was the practicing of social distancing consistently, and then the seating arrangements. So making sure that the seating arrangements are really well thought out, and that when you make those modifications, staying within the capacity that you and limitations that you then now have, because that is going to reduce the number of individuals that can enter the house of worship.
A question that came up from our reentry church committee was, what happens if you do the proper protocol of screening when people come to church? Let's say someone does have some questionable symptoms but they refuse to leave. What what do you recommend the church do? Call the police?
Well, we don't want to call the police, but if they're a member of your church and they're demonstrating symptoms, you have to inform them that that's your new protocol. So what I would advise you to do is issue a memo in advance, sort of getting everybody ready, and communicating with the members that this new protocol will be in place, and discouraging anyone that has any of the symptoms outlined should not be attending the services, because at the end of the day, allowing them to enter the services can pose a risk of other members contracting COVID-19.
No, I mean, no, that's, you know, advance notice and all that, I understand. But what if you do all that and someone is there? It could even be a visitor who comes, and you do the protocol, you do the screening and all that, and they don't want to leave, even though we say, hey, look, you got a temperature, you answered affirmatively to some of the questions. How does a church manage someone who, after doing all that you said, are there and show these concerns, physical concerns, but refuses to leave?
Yeah, that's a tough one, because I wouldn't foresee someone becoming hostile at a church, but I guess that could happen. That that you reemphasize the message. I wouldn't encourage. I mean, if they become hostile and aggressive, that you feel like your life is in danger, then obviously you need to call 911. But just sort of being stern, or having the posters very visible that upon entry, any of these symptoms that are displayed, you cannot enter, is going to be very critical. And so that's what I would advise. In that circumstance, that's probably going to be rare. But if that does occur and your life is in danger, or of the person that's screening, it will be unfortunate that would happen. But given what's happened in our country in the last 5 years of the unknown violence, and some of the things that churches are seeing now with hate crime, you do want to take the proper precautions that are necessary.
Hi, thank you. This is Tim Kyle again. I want to thank you for all of this information, and I appreciate it, in particular how we're going to address the issue of the virus toward our congregation. But I'm also aware that my building particularly has been a service to the community. So therefore the question about support groups. We also house a preschool. So other congregations, I don't know how many of you have licensed preschools or childhood centers that are going to be opening up in conjunction with the guidelines. So we'll be talking about that as well. And I just want to say to you, Dr. Bond, and your staff, that we want our buildings to be a resource as much as possible. And for example, there's an idea that churches might house some cohorts of students for the public schools. And I'd be very interested in puzzling about that. It's premature for that. But I just want to say, whatever ways that we can be a resource, please let us know. And I'm sure I'll be in touch with you, particularly because if the public schools open, then we also have a question about another program that we house, which is IRIS Family Literacy Program, which has ESOL classes, and then a preschool that's also licensed.
Yeah, absolutely. Thank you for that. And thank you for the community services. That's really important for our residents. Any last questions before we wrap up?
I wanted, I'm Manuel Romero, and I work for the library, but also I'm the new pastor for the Bethania Church here in Fairhaven, Assembly of God. So I wanted to say thank you very much for the webinar and for all the information. And I appreciate if your department can do this frequently. I know you guys are very busy, but as a secretary of the Assembly of America, I wanted to make sure all our pastors in New Haven be able to attend to those webinars, to this meeting, because it's great to have communication, to keep our city safe. Thank you very much.
Yeah, no, thank you. And thank you. I also have a weekly segment on Alma Radio on Thursdays at 10 a.m. It's a Spanish Christian station. I've been on Radio Love 69.0. And then Tuesday, I will be doing a webinar, this exact same webinar in Spanish for the faith leaders. And so if you have another outlet, and to your point, Pastor Romero, if you have another outlet where I can join a radio segment or another group of faith leaders, or you notice that a faith leader is not on this webinar, please touch base with Carlos Sosa so we can add them to the distribution list and make sure that they get included and invited in future meetings, because we want to be as inclusive as possible. And as information does become available, we do want to make the time, because we want to be able to share with you as much as we can so that you can be able to, number one, remain open, and number two, keep your members safe.
Thank you.
Dr. Bond, Walter Williams, I wanted to ask, I want to address two issues. First of all, back to the school opening. You spoke of the Zoom meetings for parents, but we know that we're dealing with a lot of underprivileged communities that don't have access to, and parents, adults who don't have access or even the knowledge of how to use the internet. And so, what means is being used to bring them up to speed. And then secondly, with regards to the schooling, I'm wondering, as far as whether or not it has been taken into consideration that the children are, though they go to school and precautions are taken there, that they're returning home to adult parents and grandparents who are,
that have pre-existing conditions. Yeah, that is definitely being brought up in these conversations. I think what will be great, Carlos, if we have a house of worship and superintendent conversation, so that the superintendent can be able to share with all of you, because I don't want to speak on her behalf, because they are making a lot of efforts to extend invitations to parents in different platforms. But I think it would be great if someone from her administration can certainly address some of the direct Board of Ed questions. So Carlos, if you can, mark that as an action item so that we can be able to reconvene this group and then have both the superintendent and myself back on this call so that we can be able to provide any additional responses to questions around reopening.
Of course.
My other question was, last month a notice went out about using houses of worship for testing sites, and I was wondering if that actually did come about.
Yes, and so they're trying to phase it in. That's an initiative by the the governor's office. And they were trying to do a pilot, and then after the pilot, they're going to make an evaluation and then offer it again in the future. And so once we get an update from the governor's office, we'll certainly keep you all in the loop. There were a few churches that were part of the pilot. I don't have that final list in front of me, but that participated, and then the governor's office will let us know if ongoing testing will happen with faith leaders so that they can be able to then extend it in different phases.
All righty, thank you.
All right, Carlos, you want to close it up?
Great, thank you, Maritza. Once again, thank you very much for all your leadership. Clergy, faith leaders, you have been fantastic in serving the community. Is Pastor Romero still with us?
Yes, I'm
Pastor
still.
Romero.
Yes, I'm still.
Can you bless us? Can you bless us with a closing prayer, please?
Thank you. I will. Thank you, Lord, for this great opportunity what we have together. Lord, I ask you for your blessing, and I know your Holy Spirit is with us, and we move into a victory in the name of Jesus. God bless everybody. Amen.
Stay safe, everyone.
Thank you. Thank you, everybody. If you have any further questions or concerns, please feel free to reach out to me. Thank you very much.